My name is Dr. Bradshaw, and this film is intended for my RAD 2612 students. Our subject is congenital anomalies, and this tape is about blocked vertebra. We have blocked vertebra has two or more segments joined together. There are two types of blocked vertebra. The first one is congenital block. You'll usually see a concavity on the anterior surface. The second type is called acquired block, meaning done surgically, and it has many different presentations. Looking at our first film, this is a congenital block, and how I know that is I see the concavity right along the anterior surface of the vertebral bodies. On the next film, there is the concavity on the anterior aspect. There is a remnant of a disc space, but this would be a partial block. This one has the concavity on the anterior surface, and so again this would be a congenital block. A partial congenital, still concave on the anterior surface. This one involves three segment levels, and you see the solid spinal laminar junction line right here. This one, the concavity is right here between C2 and C3. And the other thing that would be a red flag is should you see a foramen on the lateral cervical view, and the answer is no, so that should be a red flag to you that that is a congenital block. You can also have congenital blocks in other sections of the spine besides the cervical spine. And so this one shows a block between T12 and L1. It is still concave on the anterior surface. If we look at acquired block, this one is acquired block, and it has a wrapping or a plastic sheathing-like material wrapped around, so solid looking. So that is that one is an acquired block. Thing I want you to notice is you see how there's forming a lipping and spurring at the bottom of this vertebral end plate. There's some problems going on because of that acquired block being causing irritation at that joint space. And then I also wanted to show you this one. Sometimes they use metal to wrap around the different segments to stabilize, and so this one they've used the bendable wire around the posterior arch down to the lamina spinous process of C2. The only problem is that apparently that piece of wire has broken off. This concludes the tape on blocked vertebra.